So you all remember last year when there was that Ebola outbreak in West Africa, especially in Liberia, that caused quite a scare in the entire world. He was among the 170 health workers who were flown to West Africa early last year to help contain Ebola outbreak. He is still there even after most of his colleagues came back home. Tonight on Daring Abroad, our special correspondent Alex Chamwada speaks to Dr. Romeo Orone on his daring role in fighting Ebola in Liberia.
Dr. Romeo Orone works at the Ebola Mission Hospital in Monrovia, the capital city of Liberia. This is one of the centers that were crowded with Ebola patients during the outbreak that was described by the World Health Organization as the deadliest in history since the discovery of the virus in 1976. The epidemic in West Africa was first reported in March 2014. The most affected countries were Liberia, Sierra Leone and Guinea, with the entire Kenyan team under the UN and African Union initiative comprising 170 health workers.
First, we were taken to the ETUs, where there were patients who were still in the Ebola treatment unit. ETU is an Ebola treatment unit. But by then, when we came, at least the efforts which were there prior to our arriving were beginning to bear some fruit. And the second role was to restore healthcare, because the epidemic had a devastating effect on the healthcare system, because healthcare workers were the first to bear the brunt of the epidemic, because they were the first people to see the victim. Before they actually knew it was Ebola, it was too late. There were the people who were seeing. So most of them, unfortunately, passed on.
Dr. Orone is a general practitioner. He was a tutorial fellow at Moi University School of Medicine when the calling to serve in West Africa came.
Sometimes you'd contaminate yourself, of course, with fluids, and it was scary. But through encouragement with fellow healthcare workers, we got the courage and we pushed on.
According to the World Health Organization, the epidemic killed 5 times more than all other non-Ebola outbreaks combined. The total number of reported cases was about 28,600. Over 11,000 people had been reported as having died from the disease in 6 countries by 13 January 2016, when the World Health Organization declared the last of the countries affected, Liberia, to be Ebola-free.
The lessons are this. I think as Africans, we have to really invest in the things that really matter. Health being one of them, being a pillar, and education. And that's why I believe in public health, because prevention, they say, is always better than cure.
And why is Dr. Orone still in West Africa?
The survivors had many issues that needed to be sorted out. So they asked me whether I could be their medical coordinator.
Kenya's Principal Secretary for Health, Dr. Nicholas Muraguri, praised the role played by the Kenyan health workers.
In fact, they remained 2 more months to help with service delivery. So we're delivering babies. They were vaccinating babies when the Ebola outbreak was over. People cried when it was time for them to come back.
He says Kenyan health workers, quote, are a brand out there.
We have requests to send health workers across the region. In Namibia, for example, this year they want 300 nurses.
But with a caution.
Of course, we want a structured way of people living in the country. We don't want people to be abused, paid less. That is, for example, we want a government-to-government arrangement. For example, with Namibia, we have a memorandum of understanding of how people go, how they be paid, and the embassies are where they're involved. And so it's a very organized way of moving people.
For Daring Abroad, I'm Alex Chamwada.